A firefighter is admitted to the burn unit with second-degree burns to the face and upper body. Burn injury may be caused by exposure to heat, chemical, electricity, radiation, or extreme cold. Thermal burns are caused by exposure to dry sources such as fire or flame, or wet sources such as scalds. Those account for 80% of all burns. The fluid shift from intravascular to interstitial spaces may cause a hypovolemic shock state. Fluid loss by evaporation from the burn would also contribute to volume deficit. This shock is frequently referred to as burn shock. Burn classifications. Burns are classified according to depth of injury and extent of the body surface involved. Early burn classification is crucial because it heavily influenced the early resuscitative plan. On the next slide are the classification of burns and some examples. Burn classifications include superficial partial thickness, deep partial thickness, full thickness, subdermal, or deep full thickness. Rule of nines. The body is split into different sections and the burn percentage is determined based upon how much of the body is burned. Nursing focus with burns includes fluid resuscitation using the Parkland formula, pain management, prevent infection and complication, and evaluate additional injuries and comorbidities. Parkland formula for fluid resuscitation. Inhalation injury, suspected with altered level of consciousness. Facial burns, singed facial and nasal hair, tachypnea, rhonchi, cough, wheezing, stridor, carbonaceous sputum, elevated carbon monoxide levels, 200 times greater affinity than O2 to hemoglobin. Treat with 100% FiO2. Headache, nausea, malaise, neuro changes. Draw carboxyhemoglobin level. Situation. Patient is a 25-year-old firefighter with no previous health conditions. Full code, no known allergies. Second degree, deep partial thickness burns to face and upper chest. On admission, patient is complaining of pain. O2 sat is at 95%. Parkland formula for fluid resuscitation started in the ER. 13.5% of the body is covered in second degree burns. Patient is currently stable, alert and oriented ×4, on 1 liter oxygen nasal cannula with wife at the bedside.
Mr. Burns?
Yeah?
Hi, I'm Casey. I'm going to be your nurse today, taking care of you.
Hello?
How are you feeling since you came up from the ER?
I heard a lot of pain in this area. I have to move. I can't barely move my face and my head.
Yeah, it looks painful.
Uh-huh.
What would you rate your pain right now on a scale of 0 to 10?
Yeah, I go with 8.
Okay. I'm going to do an assessment on you and take your vital signs.
Okay. Careful though, it hurts.
Okay, I will. Are you his wife? Yeah. Okay, nice to meet you. What's your name? Very good.
She's been by my side forever.
Yeah.
It's good. It hurts though, everything hurts.
Okay, I'm gonna put this on your arm.
Okay.
Try not to hurt you too much.
Ah! That doesn't sound so bad.
Okay. it wasn't too painful.
It was well, it wasn't as bad as I thought it would be.
Okay,
You did a good job.
Thank you.
Yeah. Still hurts, still everywhere. Is there something for pain I can get?
Okay, I'm gonna put this on your finger.
Okay.
And I'm gonna take your temperature also. Okay.
Is it good?
Yeah, it's pretty good. 98.7.
Okay.
Okay. All right, now I'm just gonna do an assessment, listen to your heart and lungs, and make sure everything's going okay.
All right.
Gotta take a look.
Ah.
I'm sorry. Now I'm gonna take a listen to your lungs, okay? Try not to hurt you. I'm just gonna have you take some deep breaths in and out. Okay. Bandaging and everything looks pretty good.
Yeah, they did pretty good down there.
Good. I'm just gonna take a look at your skin, make sure everything's okay. Just gonna see your hand real quick, take a look at your capillary refill. Okay. I'm just gonna take a look at your legs, okay? No burns down here, right?
No.
Okay.
No pain down
No
there.
pain? All right, good. Okay. I'm gonna go take a look at the orders and see what I can do for your pain, see if there's any medication orders.
Yes, please.
And I will be back in to check on you, okay?
Okay.
Is there anything else I can do for you at the moment?
Just pain med would be great.
Okay.
That's all.
All right, sounds good. I'll be back around.
Okay.
Thank you. You're welcome.
Orders are as follows. Maintain oxygenation above 93%. If dropped below 93%, initiate oxygen. Initiate Parkland formula. Draw electrolytes. Draw carboxyhemoglobin level. Monitor vitals Q2. Initiate contact and droplet isolation. Administer morphine 4 mg Q3 for pain 7 to 10. Administer 1 mg Ativan Q4 for anxiety PRN. Lab results are the following. Carboxyhemoglobin level is 400 ppm, which is a critical level. Potassium 6.2, sodium 150, chloride 35, hemoglobin 7.2, and ABGs show metabolic acidosis. pH is 7.28, CO2 is 45, HCO3 is 18.
Hey, Mr. Burns, I'm back. The doctor put in some orders for some morphine for you, so hopefully that will help with your pain.
All right.
Are you bringing anything up with that cough?
Yeah, it's some weird looking stuff. I don't know what it is, but it's something. Something that's coming up.
All right.
Yeah.
Now look at your wrist again. Can you tell me your name and date of birth?
Yeah. Jim Burns, 9/10/98.
Okay. All right. I'm just gonna hang this morphine up, okay?
Is that what Doc ordered?
Yep. It's gonna go in through your IV.
Well, we're good.
It should. I'll be coming back in to reassess your pain in a little bit, okay?
I'll let you know if it's not.
All right. Perfect. Okay.
He's also been like kind of anxious too. to be
Okay.
honest.
All right. I will go see what we have for orders and bring something back in for anxiety, okay?
Okay.
Thank you. You're welcome. Anything else I can do for you right now?
No.
All right. Sounds good. I will be back in a little bit, okay?
Do you feel okay?
Who are you? Where am I? I feel kind of nauseous.
Casey? Casey? What's wrong? Are you
He's
okay?
confused and he doesn't know where he's at, and I'm just really worried about him. He has a headache and he's a little nauseous.
Okay, let's go take a look.
On second assessment, the nurse finds persistent cough, stridor, and wheezing. She observes singed nose hairs and carbonous sputum. Patient verbalizes headache, fatigue, and nausea. Patient is now A&O ×1.
Hello, it's Casey, your nurse. I'm back. Can you tell me your name?
Jim Burns,
Do you know where you're at?
Toys R Us.
Okay. I'm gonna take a look at your eyes. Is he okay? We're just assessing his level of consciousness right now. Make sure everything's okay. I'm gonna take a look at your nose. Okay. I'm gonna check your oxygen status. I'm gonna take a listen to your lungs.
Hey.
I'm actually gonna turn his oxygen up. Okay. I'm going to go call the doctor and see what he would like to do. I will be back in a little bit, okay?
Okay.
We're back.
Hello, Mr. Burns. My name is Dr. Thomas. We took a look at your labs, and it looks like you have carbon monoxide poisoning from the fire. So we're going to go ahead and initiate oxygen therapy for you, get your oxygen back up to where it needs to be, okay?
All right.
All right, let us know if you need anything, okay?
Okay, Mr. Burns, I'm back.
Uh,
Are you feeling a little better?
I can breathe now. It feels, I'm not gasping for air.
Oh, good. How is your pain?
It's a little better. Feel a little bit better. It still hurts a little bit, but not where it was.
Okay. What would you rate it?
4 out of 10.
Okay, that's better. Alright. We're gonna assess your oxygen levels again. I also brought the Ativan in for your anxiety. I'm gonna have you tell me your name and date of birth again.
No, it's Jim Burns, 9/10/98.
Okay. And can you tell me where you're at?
I'm at the hospital.
Oh, perfect. Earlier you thought we were at the toy store.
Oh,
I'm glad to see you're doing better.
used to listen to the toy store when I was younger.
All right, we're just gonna push this Ativan in. Let's shake. Okay. All right, your oxygen levels are much better than they were.
Feel better.
That's great. Okay, I'm going to contact your doctor and let him know everything's better and you seem a lot more stable. And I will be back around to check on you and we will continue monitoring you and see what we can do next, okay?
Okay.
All right, anything I can do for you? All right,
Thank you.
you're welcome.
NCLEX review questions. Question 1. The client who is burned is drooling and having difficulty swallowing. Which action will the nurse take first? Assess his level of consciousness and pupillary reactions. Ascertains the time food or liquid was last consumed. Auscultates breath sounds over the trachea and main stem bronchi. Measures abdominal girth and auscultates bowel sounds. The answer is C. Auscultates breath sounds over the trachea and main stem bronchi. Explanation. Inhalation injuries are present in 7% of clients admitted to burn centers. Drooling and difficulty swallowing can mean that the client is about to lose his airway because of this injury. The absence of breath sounds over the trachea and main stem bronchi indicate impending airway obstruction and demand immediate intubation. Question 2. Which finding is characteristic during the emergent period after a deep, full-thickness burn injury? Blood pressure of 170/100, foul-smelling discharge from wound, pain at site of injury, urine output of 10 milliliters per hour. The answer is D. Urine output of 10 milliliters per hour. Explanation. During the fluid shift of the emergent period, blood flow to the kidney may not be adequate for glomerular filtration. As a result, urine output is greatly decreased. Question 3. What intervention will the nurse implement to reduce the client's pain after a burn injury? Administer morphine 4 milligrams intravenously, administer Dilaudid 4 milligrams intramuscularly, applying ice to the burned area, avoiding tactile stimulation. The answer is A. Administering morphine 4 milligrams intravenously. Explanation. The IV route is used because of problems with absorption from the muscle and stomach. Drug therapy for pain management requires opioid and non-opioid analgesics. Question 4. What statement indicates the client needs further education regarding the skin grafting? Because the graft is my own skin, there is no chance it won't take. For the first few days after surgery, the donor sites will be painful. I will have some scarring in the area when the skin is removed for grafting. I am still at risk for infection after the procedure. The answer is A. Because the graft is my own skin, there is no chance it won't take. Explanation. Factors other than tissue type, such as circulation and infection, influence whether and how well a graft will work. The client should be prepared for the possibility that not all grafting procedures will be successful. Question 5. When providing care for a client with an acute burn injury, which nursing intervention is most important to prevent infection by auto-contamination? Avoiding sharing equipment such as blood pressure cuffs between clients. Changing gloves between wound care on different parts of the client's body. Using the closed method of burn wound management. Using proper and consistent hand washing. The answer is B. Changing gloves between wound care on different parts of the client's body. Explanation. Auto-contamination is the transfer of microorganisms from one area to another area of the same client's body, causing infection of a previously uninfected area. Although all techniques listed can help reduce the risk of infection, only changing gloves between carrying out wound care on different parts of the client's body can prevent auto-contamination. Debriefing. With burns, PPE, including a gown, gloves, must be worn at all times to prevent infection. Before administering IV medication, the hub must be cleaned with alcohol for at least 15 seconds. Parkland formula for rehydration should have been initiated in the ER before transfer occurred. Nurse should have assessed mouth and saw inhalation injury. Airway protection should have been initiated once trouble breathing began. Patient should have been kept warm to preserve core body temperature. References.
All right, I'm just gonna scan your wristband.
Beep.
Should I do all this? Sorry,
Should I?
Yeah, nurses.
Should I
Go.
tonight. Are you Are you bringing anything up for the cop? Can you tell me your name and date of birth?
Wait, hold on.
You know where you're at?
Toys R Us?
How are you feeling right now?
Oh,
Is he okay? Well,
He thinks we're at a toy store, so no. Taking it. I'm done. We're back.
Oh my, you didn't even try.
Okay, we're back. Have the doctor with me?
I just go around your head here.